Okay, today is March 11, 2020. It's the regular meeting of the Board of Stark County Commissioners. Let the record reflect Commissioner Crane, Commissioner Smith, and Commissioner Regula are present, and our Administrator Brant Luther and our Clerk Sarah Donald. If we could all rise for the pledge.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, is there any amendments to the agenda?
None.
Okay, Public Speaks, we have with us Health Commissioner KIRK Norris, and Mr. Norris, if you wouldn't mind giving us kind of an update of everything that's going on in regards to the coronavirus.
Absolutely. Today I brought with me Sherry Smith, Director of Nursing for the Health Department, and Amy Ascani, who is the emergency planner for the county as well. So hopefully with the three of us, we'll each give you 3 quick updates on what's going on,
Okay,
and then we can maybe answer any questions that you may have.
Okay.
Now, we have so much going on that I had to write my notes down. Okay, so I apologize, but there is a lot going on right now, okay? So, right now I want to let you know who we are communicating with on a daily basis, okay? So as of right now, almost daily, we are in communication with the Ohio Department of Health. We are in communication with the governor's office maybe once a week or so. That's how it's been for the past couple of weeks, okay? And we also have communication and calls with the Centers for Disease Control and Prevention. Okay, so we are communicating with those agencies. We do have another agency that's called the Northeast Central Ohio Region. So that is all the health departments within the NECO, the abbreviation, the NECO region, as well as there's hospitals in there, and there's emergency med, all those. We are communicating with those as well. Actually, Amy probably communicates with them on more than once a day basis.
More than once a day, yeah.
Okay, so we are well up on everything that's coming out of ODH and CDC, as well as NECO and the government and the governor's office. The resources that we are monitoring. So we have staff members that are directed to monitor certain resources within the state and federal, okay, websites. So as I'm sure the commissioners know, right now we have WebEOC, which was activated, I believe, last week or 2 weeks ago.
Yes, it was just
activated so that virtually all of the EMS, fire, police, health departments, we can all communicate through a virtual platform entitled WebEOC. We do situational reports, daily situational reports. Everybody knows what everybody's doing and what everybody's communicating within the county. It's all located on WebEOC.
And that stands for Web Emergency Operations Center.
Thank you.
Sorry, all the alphabet soup.
It is.
All right, so we also have a website that we're observing that's called Basecamp. Okay, now Basecamp is out of NECO, and it's an information sharing on what each individual, well, if you're on there, each individual agency within NECO is sharing with each other. So we're getting emails from, for example, health departments to the north and to the south of us within the NECO region, and what's going on within their jurisdictional authorities. And we share documents so that why create the wheel, why recreate the wheel if there's a document they can use off of from us or we can use from them, okay? So we mentioned the ODH and the CDC websites for resource and guidance documents. We are doing media monitoring. So I think it's once every other day or so we get an email from, I believe it's from NECO, that monitors the media. And we take a look at all media coverage within the Ohio area. And that, I think that's even national also.
Yeah,
within the
they're
national.
looking all throughout Ohio.
With any related with coronavirus or COVID, okay, COVID-19, all right? We monitor EpiX, which is our communicable disease surveillance tool. So we can tell if there's trends or spikes within within Ohio regarding any kind of disease or virus that we're dealing with, okay, with EpiX. We have, we call it ODERS, but it's the Ohio Disease Reporting System. So that's also another reporting system that tracks disease within, and surveillance tool that we utilize within the Ohio. And we have OPHIS, which is the Ohio Public Health Communication System, which the commissioners are also on. And that is just many agencies and collaborating partners that we can shoot it's called a health alert network also, that we can shoot out any kind of information, ask any kind of questions, document, share anything we need with whichever subgroup we need to share it with. If we need to reach EMS, we can do it with EMS. If we need police and fire, we can shoot it out to police and fire. So we also are using those resources as we monitor. So as we mentioned, WebEOC is up and running. It was activated on March 9th, and we're at a CAS level 1. Okay, so we're doing everything virtually through WebEOC as of right now. And we also are communicating. Tim and I have communicated a couple times just in the last couple days. So we are utilizing the WebEOC platform. And the only other thing I wanted to mention on my end was I wanted to give you an idea of who our community partners are right now and who we're collaborating with, because I think this is very important. Okay, so, and I wrote these down so I don't want to miss anybody. So it's all of our hospitals, our schools, that's K through 12, as well as any private or parochial, as well as any 2-year or 4-year graduate degree or graduate school, okay, as well as our universities and colleges. EMA, our emergency management agency, all fire, all police, all emergency medical services. Our chambers of commerce, we've reached out and we're communicating with our chambers of commerce, our businesses, elected officials, our township trustees, our village administrators, and our city mayors, as well as any other community partner that I haven't mentioned. Stark-Mar, Board of DD, we're communicating with everybody and anybody that we can get the word out to. So with that being said, let me have Sherry now just give you a quick update on what we're doing as far as COVID.
Okay, so I guess my main responsibility regarding COVID-19 at the health department is our communicable disease epidemiology and surveillance for infection control purposes. So we have been, since early in February, we have been monitoring travelers that have returned from geographic affected areas. And by monitoring them, we normally get notified through the Ohio Department of Health, who are notified through the Division of Quarantine and Global Migration. And then we follow up and contact the individuals and let them know that we are their local health department, confirm that they did have the travel that they were said to have. And then we go over a little bit about COVID with them, give them general information that it is a virus and how it is transmitted. And then we ask them to monitor their temperature and other symptoms for respiratory illness, including like a cough and shortness of breath. There are some other things too that we do monitor symptom-wise. And we monitor them 14 days from the time that they returned. So we've been monitoring lots of travelers. And then we also have been giving guidance to, most of our time is spent giving guidance to healthcare practitioners about the current guidance in regards to testing for COVID-19. Just a week ago, well actually it was last Friday, just last Friday, Ohio finally opened up testing for COVID-19. So before that, we were pretty sure that we already had community spread of COVID-19 here, but we didn't have the capability to test. So we are giving information on who qualifies to test, and there are different guidelines, whether they are getting tested down at the State of Ohio Department of Health lab, or if they are going through private labs, and then they follow the Centers for Disease Control and Prevention guidelines. So we are giving a lot of information about that, and it's mostly in regards to if they spent time, direct contact with somebody with COVID-19, a confirmed case, or if they travel to geographic affected areas with a level 2 travel notice of 2 or higher. Also, if they have any symptoms right now, or if they have any additional information that could make them exposed to COVID-19. So we've been doing that. And most recently, we have been starting contact tracing of cases, since there are now cases in the state of Ohio. Every case, has some contacts. This is a virus. We're not sure how virulent it is at this point. We are learning as we go. We are trying to stay updated with all the information. So that is like our main thing right now, is we're trying to contain the outbreak that is occurring. The World Health Organization just a few minutes ago did announce it as a pandemic. So we're just doing the best we can to contain this and limit the spread. We are also giving a lot of guidance to all the special groups that KIRK mentioned. And I did just print your inter-office communication from the Board of Stark County Commissioners, and those precautions are strongly what we have been recommending to everybody. So you guys are on board with all that. The respiratory etiquette, cover your cough, make sure you wash your hands, most importantly, for 20 minutes. Think of those bathrooms, a lot of the bathrooms.
20 seconds.
20 minutes. Well,
20 minutes is good
make sure
too.
you wash your hands. The longer the better.
That's good too.
But yes, 20 seconds. It is the longer the better, but we recommend 20 seconds. But pay attention to a lot of the public restrooms because a lot of them have gone to hand dryers and things. So if you have to, grab some toilet paper if there's toilet paper available and use that to, yes, open the door before you leave. A lot of people don't think about that, but there's no sense in washing your hands and then touching a contaminated object right after you do so. So that's pretty much what our area is doing.
Amy, you want to give a quick update?
Yeah, sure. So what I've been doing is, again, all those agencies and our community partners that KIRK mentioned, those are the people that I work really closely with. So it's being that liaison and being that person who communicates with all those folks and understanding what our plans are, pulling those plans out, reviewing those, but also making sure that those plans are integrating with all these other entities that we're working with. So it's a lot of the planning aspect of it. It's seeing, what's in our plans, what's in their plans, and a lot of communication, talking and working with all these other folks. Obviously, I work very closely with our hospitals. Last Thursday, they conducted an exercise at their facilities, which I was able to be at and participate and observe those exercises. So we've been doing that, even working with all of our staff with providing them with guidance, making sure they're most up to date on what's going on and what the situation is as it does evolve and it changes. So keeping them up to date with that, working close with our own staff, nursing, communicable disease, and also I help as a PIO in our facility. So it's working with all the other PIOs, which stands for Public Information Officer. So getting any kind of media releases out or public information out, doing that in conjunction with our other health departments and also with our other community partners to make sure we're all saying the same thing, we're all saying the same message, keeping social media updated as well, and even monitoring those sites and seeing what else is being said out there. So.
I have a couple questions. To follow up on what you just stated, because many of our residents don't understand that we have a county health department and we have a city, we have a Massillon, Canton, and Alliance City
Yes.
Health Department. Tell us in broad terms how that coordination, so they should always listen to any professional, but does the information, is it gonna come from the county health department, or is it gonna come from the individual health departments, or is that a coordinated effort?
It is a coordinated effort. We do, in all of our planning, it is done in, I do the planning for all 4 health departments.
Okay.
So I'm the emergency planning coordinator.
Okay.
I'm at Stark County Health Department, but I do the planning for Alliance City, Massillon City, and Canton City as well. So we do all work very closely together. And as far as disseminating messages, press releases and things like that, it does come under all 4 of us. So we do have PIOs at all 4 health departments that work together to get that one message out. So there may be times though, a department may need to issue their own press release because it needs to come from their jurisdiction. So perhaps Massillon City may need to do their own, and that's fine too, but we do coordinate our messages so we are all saying the same thing.
Yeah, just to give you an example, Commissioner Creighton, we hold a call on Tuesdays and Thursdays with all 4 health departments, okay? It's right after our state call with the Ohio Department of Health, right? So within that call, what we've agreed upon is, this is just one example, what we've agreed upon is that we would handle, the Stark County Health Department would handle communications with the schools, the K through 12 schools. We would do all the letter writing, get all the guidance ready, but then we would coordinate that dissemination with the other health commissioners. So there's certain pieces that, you know, we're working as a team. Bottom line is we're working as a
We have
team to one unified message out to the public. That's what we're trying to accomplish.
I have another question. My other question is, if anyone feels ill in our county and they go to either a stat care, they go to an emergency room, or they go to their doctor with flu-like symptoms, are they immediately now tested for the virus?
No, they are not. What they are doing is they evaluate them. They have a logarithm for testing guidelines that they are following. And that a logarithm basically says if they've had exposure, direct exposure to a known contact case, or any exposure to any of the conferences that we know that there was cases at, if they've had geographic, travel to geographic affected areas, also if their respiratory panel for other things like rhinovirus and flu come back negative, then they will go ahead and probably contact the local health department, and the decision to test has to be in conjunction with the local health department and the healthcare provider.
And because it is a virus, am I correct that it is not treated with antibiotics?
You are very correct in that.
So is there a treatment or a cure that we are aware of for the virus?
Not at this time. Like I said, it is rapidly evolving, and they do have antivirals in experimental studies at this point that, you know, may work, may be effective, but it's mostly supportive care for viruses generally.
Does it always result in death?
No. But those at highest risk are as they age.
Age.
And other comorbidities, of course.
And who says getting old's fun?
Does that start at 65 or 60?
Come on now, come on now. No more. Okay.
Anything else? Brent? Anybody?
Just great partner, good communication. Appreciate the fact that we can pick up the phone anytime, back and forth.
Absolutely.
Yeah, we really
Continue
appreciate
that.
you.
If you want us to
Coming in
come
today.
back next week or the week after, let us know. We have no problems. We are ramping up a little bit right now because you know, Corona is here in Ohio. So we are ramping up a little bit. Just another point, we have been we activated our incident command structure within the department, I believe, on March 2nd.
Yeah.
On March 2nd. So, depending on any news that we get within the next week or week and a half or 2 weeks, we may be ramping that up and contacting Tim and with the EMA. You know, it may be, you know, we may be needing to ramp things up depending on how this moves and where this goes.
Yeah, one other question. Again, I'm asking these questions just because I know this information will be dispersed. Explain to us how you and our Tim Worsler work together from our emergency talk to us a little bit about how that.
Okay, I'll let Amy
Yeah.
can do an excellent job of doing that because she's one.
We work
Okay.
Guys,
very
no.
close. We work very close with EMA, and I work very close with Tim. So we're always working together with our planning and anything that's going on at the time. Of course, in a situation like this, we work even closer. And the Web EOC has been an excellent tool. We really like it. It's been great for all of us and all of our partners as well to post things, to share things. But as far as in an event like this, you know, since I know the EOC has been activated at a low CAS level 1. But if things do ramp up and we do need to actually increase the level and have people physically go into the EOC, that is where I would continue to work close as a liaison with the EMA. So I am that person who can bring the information as to what's going on at the EOC back to all of us, back to public health, and vice versa. So I'm like that middle person there. So if questions come up within the EOC, maybe from a hospital or somewhere else that comes to the EOC with a question, and it's directed towards public health, I'm that middle person who can then find the answer, find what is needed, and take it back to the EOC and share that information.
So the public should feel, what's the word I don't wanna say comfortable, but the assured that there is a lot of things happening underneath the umbrella that are not always
Oh,
visible
absolutely.
to everyone. I'm saying this as a way of, hey, folks, you know, there are things happening, even though you may not read them or hear them or see them. Activity is taking place to protect all the citizens of Stark County.
A lot of activity is
And
taking
what
place.
else is important for the public to understand is that this is nothing new for us. COVID-19 might be new, but as far as disease tracking, contact tracing, we do this on a daily basis. This is nothing new to us. That's why you don't see us panicking.
Right.
This is a normal day for us, except COVID-19 is a new virus.
And COVID-19 is the coronavirus.
Yeah.
But it now have two names.
A novel
Okay, because I
coronavirus.
think that can be confusing
It
to
can,
some
because
people.
there's-
that don't
There are
operate
several
in the many
coronaviruses.
Yeah.
So,
Well,
yes.
Okay, so
There
that
are-
to me again.
Yes, there are several coronaviruses. There are several of them that are pretty common, like the common cold. This is specifically novel coronavirus, which is SARS-CoV-2, which we're calling COVID-19. So, yes, I know it can be confusing, but
That's a good point.
yeah,
Yeah, well, the public doesn't understand that.
I know that.
They understand that if they see somebody sneeze or somebody has the flu,
Yes.
already they have put them in the position of having.
I know.
Yes.
And we are
That-
trying to get
that's-
that consistent
And that's where the
messaging
panic's
out.
gotta stop. I
Yes.
mean,
And we are actually working on
Thank
that.
you.
That's a big push with the Ohio Department of Health as well, with, labeling and,
Stigma.
stigma. So we are getting that information out as much as we can to all of our agencies and private physicians and, because the private physician base is also part of our health alert network that we get information out to and, so we are trying to get that word out. But yes,
I mean, another piece of that is when the governor declared a declaration of emergency, or if other entities do that, that's not a Chicken Little declaration that the sky is falling. That simply is a key to
Exactly.
open the door to federal funding should the need arise for those federal resources. I think that's another point of
Yeah,
confusion,
yeah.
that people hear state of emergency and they think, go home and get in the basement and don't come out. And that's understandable, but I think it's important to explain that is the key, that's the official piece to open the door to federal funds to help entities like yourself to deal with this
It's
and have the
another tool in
resources.
the toolbox.
Right.
That's what it is.
and nationwide, are there any cases that you're aware of a youngster? I mean,
No.
I know we've
None.
talked about the older generation, but are there any youngsters that you're aware of?
I am not aware of that in the United States. There were some cases in China, because they had so many cases, like over 100,000 cases, but still, even the cases that were in young individuals in China, it's still, the severity of the disease increased with age. I actually do not know of any worldwide. I could be mistaken, but I have not heard or read of anyone under the age of 18 dying from COVID-19. And that could be because there are so many different coronaviruses that they may have some exposure and some immunity to some of the common coronaviruses that might help give them a little protection in this case, is what we're being told, so.
I'm out of fuel.
Tim, you want to comment at all, or?
No, just briefly, is whatever Amy and KIRK has needed over the last few days, we'll certainly address, and in the coming days, should there be actual requests, we do have a liaison from Ohio EMA in our office. They'll be there probably the next couple of days with us, just in case. And we're just sharing all the information that they are providing. We're not creating any new content. It's just helping to promote whatever whatever's being produced by ODH and by the local health departments.
And there's Tim has my cell phone, I have his cell phone, there's no barrier for us to talk. We made sure that with all our service, everybody that needs to get in contact with us has either my number or Sherry's number. So there is no barrier, no voicemail, the ones that have to reach us are reaching us on a daily basis, so.
Well, we thank you for coming in.
Appreciate it.
Thank you.
And